Coronavirus sneaked on the world like a nighttime burglar. No one was prepared for it, and no nation set aside money for the purpose of battling it. It has bred all kinds of problems and kept more than 4 billion people indoors. It simply changed the way we live and interact as residents of a global community. From its initial enclave in Wuhan, Hubei province of China, the virus, now named COVID-19 by the World Health Organization (WHO), has spread to every continent of the world. It made its way into Nigeria on the 27th of February when a visiting Italian from Milan, Italy, became the index case in the country. The COVID-19 pandemic has not only devastated the global economy, it has also altered the way the human race lives and interacts. Just like its cousins, the Middle East Respiratory Syndrome (MERS) and the Severe Acute Respiratory Syndrome (SARS), COVID-19 is a respiratory tract infection. It thrives in crowded places, passing from one person to another in a chain that has now entangled the globe and brought humanity to its knees. To break this chain, social and physical distancing became the norm, forcing human beings into their cocoons. One other preventive measure is the use of masks. Every human pandemic that had ravaged the world left one form of relic or mark, and for COVID-19, the most iconic is the fabric mask. Like the virus itself, there is raging debate about the proper mask to wear or how to use it. On this, medical experts have delivered various verdicts. There are basically two types of mask: the medical or surgical mask and the non-medical mask. The medical or surgical masks are fairly loose-fitting disposable masks used by health workers, especially those treating patients. Popular in this group is the N95 respirator or mask. It is a respiratory protective device that is made by synthetic polymer fiber and designed to achieve a very close facial fit. Its N95 designation means that when properly used, the mask blocks at least 95% of very small particles. Another type of medical mask is the N98 respirator, which is also made of fiber mesh synthetic polymer. It has the capacity to block 98% of very small particles. The KN95 respirator is the Chinese version of the American N95 respirator, with significant difference in design and face fit. On the other hand, the non-medical masks are face covers made of fabrics or common textiles, which are usually cotton. They are the most common and usually not standardized, so they are not intended for use by medical personnel in healthcare centers.
This is not as protective as this.
A medical doctor based in Asaba, Delta State in South Nigeria, Princely Adigwe, describes them as mere accessories worn by people.
The fabric mask came into play because there was shortage of these medical masks. Not just shortage, it was also very expensive, that even the average man will find it difficult to afford a pack. A pack of this in Asaba costs 16,000 naira. So let's see, the regular woman in the market who sells tomatoes may not be able to afford a pack of 16,000. Therefore, the government came about making this material mask. So in the place of this, you use this. To an extent, it confers you protection rather than not wearing anything at all. It confers you protection, but it is not as effective as this.
Following government's directives for compulsory use of masks in public, many types have flooded the Nigeria streets. From the surgical, the simple and colorful, even to the most bizarre, different types of masks adorn the faces of people everywhere. On the streets across Nigeria, opinions about their use vary.
As for me, it protects so many things, like dust. Apart from this COVID-19 virus, it prevents you from inhaling dust. So, and the convenience is okay. I don't think there's any difficulty in using it.
Just to the business, the study, this way of my business, of my work rather. So I'll be used to it. And when the governor introduced also this face mask, and I also thought it's a good idea.
This one that you use, how much do you buy it? Is it expensive?
It's not expensive. It's just there's some that I bought around at a rate of 15 naira, some is 100 naira, because I have as many as I can.
Even without the government asking us to put it on, we should know that our health is the first thing to take care of. Our health is the first thing to take care of. So we should know that whatever a medical man says we should do, we must comply to it.
The level of compliance with the use of compulsory masks also depends on some factors like availability and convenience as a result of prolonged use.
When I came out today, I was putting my face mask on, but because of the crowd, the heat and all that, I just had to temporarily lower it down, you understand? But I'm very conscious of my face mask because if I enter any transport or where people are, I have to put it on.
Not quite long that I remove it. It's inside here. We should be using it because it's very, very important. Because it will go a long way to protect us from the pandemic.
Really, it is suffocating. It's not easy. But when you are talking to someone, it is good you put it on. But when you are alone, because I don't believe this sickness is an airborne disease. It's not. So when you are close to somebody, you have to put it on. Like if I want to sell now, customer is very close to me, I have to put it on. But when I'm alone, I remove it. It's I was told, I heard from someone that a lady slumped after wearing this for hours, couple of hours. And I believe it's true. So once in a while, we have to remove it if you are not with somebody.
So many people are not wearing it because it's very inconveniencing. It brings heat. But, after some time, you want to relax yourself, they pull it. If you look around, you see that some people pull it. After some time, they wear it again. Because something that you are not used to, for you to just start to adapt to wearing it all through the day, it's not easy.
Biologically, when we inhale oxygen, we breathe out carbon dioxide. But using this thing, the guy said the same carbon dioxide that is breathing out is taking it back again. So it makes, at times, he feels weak. So I think that's just the disadvantage.
While experts agree that non-medical masks confer some protection, they are not as protective as medical masks. The Director General of the National Agency for Food and Drug Administration and Control, NAFDAC, Professor Mojisola Adeyeye, says our organization is working on emergency use authorization of face masks in the country.
We have reviewed our protocols and we have started expediting the approval under emergency use authorization for different personal protective equipment. And this includes face masks, protective gowns, and things like that. It is important that we expedite the approval because actually I should also mention medical devices, test kits. It is important that we expedite the approval because this pandemic is new to the world, and the devastation of it underscores the importance of why we should take it as an emergency use authorization.
But how protective are ordinary face masks? Professor Adeyeye and other medical experts offer some explanation.
There are different types of face masks. You have the non-medical, which is what you and I may use if we go out to grocery shopping, go to the community. And then you have the medical face masks. the medical face mask can be the surgical face masks or respirators. The surgical face masks are used by healthcare workers, but the level of protection is not as great as the respirators. For respirators, you have N95, N98, and KN95. The N95 can filter out particles less than 0.3 microns, very, very tiny particles, that's where the virus's size fall under. So the N95 will filter out 95% of such particles from getting into the nostrils of the user. The N98 will filter out 98% of such particles. And the KN95 is just the Chinese version of N95. So those are medical face masks. For you and I, it is extremely important that we know the type of the ordinary face mask or barrier face mask that we should be using. First, because all face masks, handmade face masks or locally made face masks, are not equal. It depends on the thickness of the material that is used, and we are putting that rather into our own consideration to protect our people, meaning that we're going to be we're going to base our approval on the type of material that is used, and there is a simple test that can actually be used to see whether the ordinary face mask that the common man like us will use, whether it is protective enough or not. If you light up a cigarette lighter and you can blow off the flame of that cigarette lighter, it's not protective enough. So if it is thick enough and you blow out, you try to blow out the flame, it doesn't blow it out, it's protective enough.
I'm wearing my face mask. You are wearing your face mask. We are sitting, your sitting positions are in opposite positions in such a way that your breathing is channeled to one direction and the other person's breathing is channeled towards another direction. The protection rate at that time is it's very as much as even 95. The chances of contracting the virus is as little as 0.15. But in a case where you are wearing, I am not wearing, it steps it down to as much as 75%. You are still at risk. You are still at risk. But where both parties are wearing, there is less risk. So I cannot just say that, yes, I'm wearing this, I am 100% protective, and the next person sitting next to me is not wearing it. So each person ought to wear the face mask, whether in a meeting, in the market, anywhere. Wear your face mask. It reduces the chances a lot. But do not forget to wash your hands or use your hand sanitizers. Because if I tell you that face masks alone will protect you 95%, 75% without washing your hands, then I'm lying to you.
Due to the coronavirus pandemic, the global economy is shrinking and the fashion industry is one of the hardest hit. Despite this reality, the demand for masks has soared. Indeed, while the fashion business struggles, masks are now a surprise revenue generation for designers.
How many pieces you made?
I made 12,000.
Helen Okekunle, a fashion designer based in Asaba, says they now make masks more than they make dresses.
So people are not making clothes like before, but if you make clothes, they come in, when they bring in their fabrics, they request that you produce a face mask with the same fabric you're using to produce a dress for them. So that when they wear whatever attire they're wearing, they wear the same face mask made from the same fabric. Do you get? Yes, so that's what they request for now. And some of them also request that you detail it. Some of them request for stones, some beads, and the rest of them.
What about for your own? Do you make face masks? And what kind of face masks?
Yes, we make face masks on our own. We make the 3D face mask. We sell to customers who walk in to buy. And we produce several colors. Some people request for black, some request for white, depends on what they want to use it for. We made for some organizations, from companies too, for their staff.
How do you know sizes? How do you know the size of face mask?
There is a size chart that we use to produce the face mask. The sizes are 8 by 4, 9 by 3, 9 by 3.5, and 9 by 4. Depends on how wide the face is. Although these are for adults, not for children.
A Lagos-based fashion designer, Seun Ononusi, also corroborated her story.
It has really affected so many business now, so especially fashion business generally. Apart from even those who are sewing, apart from we fashion designer now, even those who are selling those materials and everything, it has really gone up. So we just want it to stop, and so everything can go back to normal, and so that people can start ordering for clothes from from different countries, because now everybody are just waiting for where this will stop. So people they've not started ordering anything. It's just because of this COVID-19. So I just want everything to stop so that we can go back to normal.
According to a report by Philip Consulting, the global fashion industry is worth more than $2.5 trillion, out of which Africa contributes less than 1%, while the sub-Saharan fashion industry is worth $31 billion. Nigeria accounts for 15% of that amount, which is about $4.7 billion. Nigeria's small market share can be attributed to factors like low purchasing power of the average Nigerian, inadequate finance, infrastructure deficit, epileptic supply of electricity, and poor transportation network. All these are compounded by the COVID-19 pandemic. Before the pandemic, an average person working in the fashion and apparel business in Nigeria earned around 191,000 naira per month, ranging from 111,000 to 302,000 naira. With the restriction on interstate movements, the fashion industry is going to struggle more, with a huge fall in revenue. But now, the mask is serving as a stopgap, and its production has become an industry on its own.
Somebody can bring a fabric and he said that he wants a face mask together with the making of the clothes. We can make it, you understand? And we still have the one we sell. Understand? Some people used to pass early morning, maybe they forget their own at home. They will buy from our hand.
So the rope will be tied around someone's head. It depends on, there are different shapes of face masks. Some people try to curve it according to the nose, so it depends on how you want to make it. But basically, this is the shape that the shape that is used by what is it called? Developed world. That's what they use. As in the already made face masks we buy from the market. This is exactly the shape that's normally comes.
Now, Fine is bringing 10 kobo to their desk. It's better. I prefer patronizing them, because in that way they will have something to eat. There are two big posts in a football field. One is the virus and the other is the hunger. So if we are using one stone to kill two birds, it's a plus. The mask is saving us, and also the money that they will make from the mask is also saving them too. It's a win-win stuff.
While experts believe that it requires special skills to make high-quality fabric masks, Some fashion designers say with more support, Nigerians can make the N95 mask and even personal protective equipment.
We can make it, yes. We just pad our fabrics with filters. Some of the filters we use can be stays, different kinds of stays, but the light ones that air can pass so that whoever is wearing it can breathe. When you tell them that this one is N95, it has padding and the rest, they'll tell you, no, it's too expensive. We want it cheaper. Give us 400 naira. So with any material and give us, after all. Don't even double it. So some customers are like that, but most of the time, we have to encourage them to get the good one, so that it will protect them. But if you do the N95, it protects because there is filter in between the fabric. So it tends to stop particles from passing through the face mask.
When we saw it, we have something like this.
In Akure, capital of Ondo State, Moradike Babajide is a fashion designer with a difference. Moradike sews fabric masks for free.
I make face masks with fabrics, leftover fabrics, and some new fabrics I have to make face masks. I make use of elastic, thread, and the machine. I'm doing this for free. I give it out to people. This should be the 200 face mask I'm giving out to people. And I'm using this medium to probably help people who can't afford a face mask, because the price is gradually going up for 300, 200, and this is really not helping people around us. So I'm using this to help people around me, so on social media, on Facebook, on Instagram. Anybody, I put my address and phone number there for people to come and pick it in my office. We are not bringing rice, we are not giving out foods, but at least for people to be comfortable and not spend money for food to buy face mask.
When you go out this, you say love face mask. When I mean face mask, you have some that are like handkerchief. They're actually not preventing anything. Do you understand me? Because they believe that once you just get a material, put the ear holder, then that's a face mask. I don't think that's a face mask. That's why I trust only my friend's face mask. I have a designer, Afele Links. He actually made this one for me. He has been doing a couple for some people that I know, and some professionals have actually tested his own. Yeah, they've tested it to see that yes, this is good. He has the ability, he has that sense, he has that wisdom to know that the face mask is actually preventing something. You're not wearing it for fashion or to make shakara or anything. You're actually wearing it to prevent something from coming into your body, and that's why he has lining inside that is arranged accordingly. So I think that's it. A lot of people do face masks just because they want to cash out. You know, it's 100 naira, 200 naira, 500 naira. I can do 10 and sell it, and there will be money. It shouldn't be for money. You should do it to save people's life.
For now, it seems masks have come to stay, and their reign may last longer than expected. Despite the protection masks offer, experts overwhelmingly agree that taking safety precautions like hand washing and keeping physical and social distancing remain the best ways to curb the spread of COVID-19.